for safety purposes, if we need, always get a tray, okay? The tray helps to organize. Now, Anconius. Can you see this bulk? Straighten. Pronate. Pronate. Can you see this bulk? This is the Anconius. This is the Anconius muscle. How do you find out the muscle? You put one dot very close to the lateral epicondyle, one dot on the olecranon, and then draw one line almost on the upper one-third of the olecranon, upper one-third or upper quarter of the ulna. So if you join these three lines, 1, 2 and 3, you can see this muscle here. This is the muscle. Okay? This is the Anconius. Now let me assess where is the most painful point. और ऊपर यहाँ पे नहीं है, यहीं पे जरूर और नीचे जाए तो so what I find was the pain here. All right. পেছন থেকে দেখতে পাবেন না, দাঁড়াতে কিছু এখানে যাও বাচ্চা এখানে আমি এখানে মিডিল ডোবরা আপ টু ইউ আপ টু ইউ তো বিষয়টা দেখতে পাবেন সুন্দর শান্তি আর মাথা নিচু করতে হবে শিওর এই যে দেখতে ভালো বুঝে যাবে মাথাটা এখানে রেস্ট করছি মাথাটা পিছনে আর এটা ওকে সে হাতে ফুটি মাথাটা ধরে ধরো আই এদিকে দেখো এটা আমি ওদিকে ধরে যাচ্ছে ওদের মতো যেমন জায়গায় ঠিক আছে Huh? Two groups? Yeah, we'll do that. So I'm using a 25mm needle. Find the point of maximum tenderness and direct the needle towards the ulna. Okay? Towards the ulna. Reach the painful point and I have reached the ulna. If I pull back and push, you will see that it stops there. Painful. So this is it. Okay? That is Anconius needling. I'll wait for some time. कल needle हुआ था क्या आपके? उस हाथ पे हुआ था. पेन है उसका? बहुत कम है. Which means he is not a strong responder. And he already has a pain. I'm tempted to do a little bit of fishing. It's almost towards the insertion. So I'll pull back a little, change the direction and push a few times. All right, done. We'll remove it. We'll check his response after some time. So that was Anconius. Now,
So, one more আরেকবার হচ্ছে অ্যাঙ্কোনিয়াসের প্যালপেশনটা বুঝিয়ে দিন না, ট্রায়াঙ্গেল করে যেটা আপনি করলেন তখন।
straighten, pronate, tighten. This is the bulk. Can you see the bulk here?
Yes, sir.
So basically one on the olecranon, one on the lateral epicondyle, and one on the upper more or less 1/4 of the ulna.
Okay.
Join these three triangle, you get the Anconius.
Okay.
Done. Yeah? हल्का होगा? चलो दूसरे मसल्स पे भी आप ही पे करूँ कि किसी और को दे दूँ? बिकॉज यू आर ए पेशेंट करूँ? ठीक है, चलो. तो now the supinator. We'll do another group. When we do another group, please ensure that the people who are having difficulty in standing, they should stand in the front. It's not के सामने जो लोग यहाँ भी खड़े हैं वहाँ पे चलेगा तो उसमें फिर प्रॉब्लम है. We'll do here only. We'll just reshuffle the people who are standing front and back. Or if you want me to go there also I can go, but whatever is more convenient. Supinator. For supinator, ideally I should be standing in front of him, but I can do from behind also. This is the bulk of
Brachioradialis.
Remove the brachioradialis bulk. More importantly, feel the head of the radius. So this is the radius here. We have to go at the level of radius. Pronate. This is the head of the radius. Now hold your index on the head of the radius. Remove the bulk of the brachioradialis and go anterior to posterior vertically down at the level of your finger. So imagine I am fixing my index in his head of the radius. I am using my thumb to remove the brachioradialis bulk. My needle will be directly towards my finger. That is how you needle for the supinator. For everyone, you need a 40 millimeter needle. Which I understand today, you have both 40 and 50. They are almost similar length. The packet is similar. When it is full, then it is 50. This is 40, a little shorter. So 50 and 40. If you are doubtful, see the writing behind. Finger on the radial head, thumb on the brachioradialis. I am shifting it. I am direct. Relax. Shabash. Unless the patient is relaxed, you will not get any, like it will be very difficult, painful for him and painful for him and for you, the needle will have difficulty in going in. So I am at the level of my index. Bottom is my index. Now I will tap and push because I am getting just the tip. I cannot tap like this. I will tap and push. The needle is in. Go deep. And I have reached the radius. It's not going anymore. Done. Here don't do any fishing. Because if you do fishing, you probably go towards the radial now. Right. So that's on the supinator. If I release this now, what will happen is the needle will bend because the fascia tightness is there. So don't worry about it. But when you take it out, pull back, make it straight and pull it out. It's much more comfortable for the patient. The third muscle to be needled is the brachioradialis. So here the problem is, first you have the skin, then you have the brachioradialis, then you have the longus. So you have to isolate the brachioradialis because you don't want to go into the longus. Because between the brachioradialis and longus you get the radial nerve if you reach the bone. So this is the skin, can you see? After that you get the brachioradialis here. Pull, 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 pull. आपके तरफ खींचो. ये यही चाहिए. और खींचो. ये है brachioradialis. Okay? Relax. Please do. Wrist को उठाना. Wrist extension. Bring it down. Up again. Okay. So I want to doubly ensure by asking him to elevate the wrist. I know where is the extensor carpentalis longus also. So what I have done, I have held the brachioradialis. This is skin. Below this, my brachioradialis is there. I'll use a 25. So all these things can be handled with one hand also. And find the point of maximum tenderness. Tap. I'm directing the needle towards my index finger. My index is here. So that if the needle pushes back, needle wants to come out of the other side, you'll get to know before it goes inside out. So now it is on the Brachioradialis. Lift your wrist up. No movement on the wrist extension. अपने तरफ pull करो. Can you see the movement on the needle? Relax. Which means it is on the brachioradialis. If it was on the extensor carpentalis longus or brevis, with wrist movement the needle will move. That means in wrong. I have not been able to go to the structure that I wanted to. If the patient was having a longus pain, then that is good only. But then that is not the technique. The longus has to go away from the radial nerve. Done, right? So this was, what was the muscle?
Anconius.
Anconius. Anconius. This was brachioradialis. Supinator anyway, I have shown where to do it. The fourth one is called as periosteal packing. Okay, for the second demonstration, shall we do it here or shall we go there? এখানে ঠিক আছে বেশ যারা দেখতে পাচ্ছে না অলরেডি হাত তুলে রাখো তার সামনে চলে এসো মারামারি বাসের সিটের মতো মারামারি না হয়
না না বন গেল এটা সাইড দিন
Okay. So imagine this is the point of maximum tenderness. Now he will get neck pain. When we say the lateral epicondyle, we think it's just a spot, but actually it's a large bone, you know. So it's a large part of the bone, and you find out where is the pain, here or here or here or here or here. Imagine that the pain is at this point, and you start needling this area, it is not going to get any benefit. So find the point of maximum tenderness. Imagine it is here. What do you do? Tap it. And then at the point of maximum tenderness, what I'll do is, imagine this is the bone. I'll do tap, 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 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, at least 15 to 20 times. It is painful. So I'll do 1 or 2 times for his hands. Right? So he's not getting pain, so I'll do a few more times. Just on the bone, just trying to scratch the periosteum. After this, once this is done, I have not done too much.